I did feel like they actually cared about you, because they are the ones that are there for you at your worst and at your best.
Today, we're going to discuss the step-by-step process that happens prior to, during, and after you or your child has a cardiac catheterization. While this video may not cover every detail, it will hopefully answer many of your questions leading up to the procedure. If this video doesn't answer all of your questions, you still have an opportunity to speak with a nurse practitioner when they call you 1 to 2 weeks before the procedure. When you are called by the nurse practitioner, they will briefly review what a cardiac catheterization is and what the specific plan will be for you or your child. They will ask you about medications and medication allergies. They will also ask questions to make sure that you or your child is healthy enough to undergo a cardiac catheterization. Lastly, they will tell you what day and time to come to the hospital for any additional tests that have been scheduled before the catheterization, like an echocardiogram, a chest x-ray, or blood work. We try to move through these tests quickly, but you should prepare to spend most of the day here. Unless told differently by the nurse practitioner over the phone, you can continue to take your regularly prescribed medications and maintain a normal eating schedule during this pre-procedure workup. If you or your child becomes ill or shows symptoms of illness prior to the procedure, please contact your nurse practitioner as well. This includes cough, fever, difficulty breathing, or other flu-like symptoms. This does not mean that your procedure will be postponed. However, we want to ensure that we make the procedure as safe as possible. During the pre-procedure workup, you may meet with the social work team who will make sure there are no insurance issues and that you and your family have the support you need for the procedure. If you have any concerns about insurance, lodging, transportation, family resources, or emotional support for you or your family, please contact us for assistance. To make sure insurance issues don't delay the procedure, please ensure that you've received an authorization or referral from your primary care doctor if needed. You are also able to visit with a child life specialist prior to the visit. Child life specialists are healthcare professionals who work with children and families to help them cope with stressful situations while in the hospital. You may request a child life specialist prior to or on the day of the cath to assist with a distraction for your child. The night before the catheterization, we recommend that the patient showers or bathes. This is the last opportunity until a few days after the procedure to do so. Any kind of jewelry, makeup, nail polish, or contact lenses should not be worn the day of the catheterization. There's not a specific diet plan for all patients, so please follow the instructions given by the nurse practitioner about eating before the procedure. The nurse practitioner will also give you instructions on you or your child's medications for the day of the procedure. On the day of the procedure, please come to the 11th floor and check in at reception D. From that point, the nurse practitioner will take the patient and their family to an exam room. If it wasn't done the day before, the nurse practitioner will review a history and perform a physical exam. You may find at this point you're being asked the same questions again and again. That's not a bad thing. We're checking the information to make sure that nothing is missed.
I felt safe all the time, and there was never really a time when I didn't feel safe and like I was in good hands.
After the exam, you'll meet with the doctor who will be performing the cardiac catheterization. This doctor, called an interventional pediatric cardiologist, has received special training to perform the procedure. He or she will have already reviewed the medical records, but may ask a few specific questions and repeat parts of the physical examination. The doctor will then go into detail about the planned cardiac catheterization procedure. This is a great time to ask questions to make sure you understand exactly what will be done during the procedure. Next, the doctor will review the risks of the procedure and have you sign the informed consent document. If a child is having the cardiac catheterization, the informed consent needs to be signed by a parent or legal guardian. If this is not possible for any reason, we will need to make special arrangements in advance. Once the consent form is signed, either a nurse or technician from the cath lab will take the patient from the exam room to the prep area. In the prep area, you or your child will also meet the anesthesiology team. For most catheterization procedures, there will be some form of sedation to ensure comfort during the procedure. The anesthesiologist will explain the plan for what type of medications will be used. Not all procedures require the same treatment, which is why it is important to have this conversation. At this point, you or your child will be taken to the cath lab for the procedure. Family members will be taken back to the waiting room where they will wait while the procedure is being performed. While in the waiting room, you have the option of getting a pager so you can go for a walk or get some food. Please note that the pagers only work within the hospital, not in the parking garages. We will use the pager to contact you when the procedure is over and the doctor is ready to speak to you. While in the cath lab, the patient will be treated by dedicated professionals whose only goal is to take care of them. When possible, they will make sure that you are updated on your child's progress. These updates are usually done by the nurse practitioners. Many people want to know what actually happens during a cardiac catheterization. Catheters are thin, hollow plastic tubes. We move these catheters through the arteries and veins in the body to get to the heart. To get into the arteries and veins, we will typically make a small hole called the access site in the leg. Depending on the exact anatomy, sometimes we make the access sites in the arms, neck, or rarely in the side through the liver. Once the catheters are in the heart, we measure pressures and oxygen levels in the different parts of the chambers of the heart. We also inject a liquid called contrast, which lights up the heart structures. Depending on the reason for the catheterization, we will then perform interventions, which may include closing holes, opening narrowings, or a variety of other things. Once we are done, we remove the catheters and hold pressure on the access sites until the hole is closed. The procedure can take anywhere from 2.5 to 6 hours. We will try to give you the most realistic time estimate before the procedure starts. After the procedure is completed, you or your child will be moved to the recovery room, where a dedicated team of nurses will make sure that the vital signs are stable. For most procedures, you or your child will lay flat for 4 hours in the recovery room to make sure the access site heals completely. Family members may visit their child or loved one in the recovery room once they are awake. The doctor will come meet the immediate family in the waiting room and review the results of the procedure. If you are the patient having a cardiac catheterization, the doctor will come discuss the results of the procedure with you once you are awake in the recovery room. Drinking liquids is permitted once you or your child is awake, but typically we wait to serve food until the patient feels up to eating. You or your child may also need to stay overnight depending on certain factors. All of our patient rooms are private, so parents or an immediate family member can stay overnight in the same room. If additional family members, including siblings, need lodging, we can help arrange that ahead of time. By the next day, you or your child should be able to remove the bandage. We'll review the easiest way to do that, or do that for you if you stay overnight. During the next few days, we ask that the patient takes it easy so they avoid any serious bruising or bleeding at the cath site. We also ask them to avoid baths and swimming for a few days, but showering is allowed 1 day after the procedure. Not all patients heal at the same rate, but many are able to go back to work or school after only a few days. This will be determined from conversations with the nurse practitioner. We look forward to your family's visit and hope that this video has been informative. If you have any questions or concerns, we encourage you to write them down so they are addressed by the nurse practitioner during your upcoming conversation.
You can also contact us anytime at 734-936-7784.
I do believe it was like the best place that I could have gone to.